Good morning, nurses. I hope you all are well today, and I thank you for joining me. Today we are going to look at the use of garlic as an alternative or herbal medication. I think you might be a bit surprised to see just how beneficial garlic can be. So let's get started. Garlic is known, first of all, by many names. It's known as coarse garlic, Allium sativum, that's the Latin name. It's also known as Ile, Allium, Nectar of the Gods, Poor Man's Treacle, and Stinking Rose. And it's also known worldwide as the Wonder Drug. Garlic has many medicinal uses. It lowers blood cholesterol, prevents arteriosclerosis, lowers your blood pressure. It's a treatment for heart or cardiac disease. It lowers blood glucose. It's used to treat stomach and colon cancer. It is a broad-spectrum antibiotic, a mosquito repellent. It reduces the symptoms of hay fever, helps with heartburn and indigestion. It's an anti-inflammatory, and it boosts the immunity system. Thus, it's the wonder drug. The active ingredients in garlic are acetylene and diel sulfides. Acetylene, which is the most powerful medicinal compound in garlic, is released by crushing or finely chopping and using the garlic raw. The finer the chopping, the more intensive the crushing, the more the acetylene is generated and the stronger the effect. Acetylene begins to degrade almost immediately after it's produced. Therefore, you need to use it as quickly as possible. Aged or cooked garlic will destroy the acetylene agent. Cooking degrades faster, and microwaving destroys it even faster and completely. Acetylene is the active ingredient that's found in aspirin. Diel sulfides, they're not as volatile as the acetylene. They do not degrade as quickly, and the health benefits will survive cooking. Garlic needs to be crushed or chopped to produce the sulfides. They do not share the antifungal properties, but they are good for the cardiac system and in controlling cholesterol. They have a reputation for boosting the immune system. Sulfides break down in the body within a few hours, so it's best to use a little bit more often. Some of the side effects of garlic include, of course, halitosis, commonly known as bad breath. Offensive body odor. It can cause damage to the digestive tract if eating in excess. Therefore, again, eat little bits more often. Allergic reactions would be skin rash, fevers, and headaches. Garlic causes a lot of flatulence. It also disrupts anticoagulants, so basically it's a blood thinner. So you do not want to use garlic or administer garlic before surgery. If used too much at a time, it can cause oral pharyngeal or esophageal burning and heartburn, diarrhea, nauseous, or vomiting. You should stop administering immediately. It may also cause skin blistering and burns if you get too much juice from the garlic on your hands. Garlic does come with some warnings. It's beneficial and healthy herbal food. However, it is very powerful. And again, I stress, eat less, more often. Garlic can cause harmful side effects for those taking HIV or AIDS medications. The most serious risk associated with garlic is botulism. Its sulfurous nature makes it a prime breeding ground for Clostridium botulinum, which we know as botulism. Botulism is a toxin that can result in major stomach illness and potentially lead to death. Wash your garlic thoroughly before consuming it. The availability of garlic is pretty extensive. Besides fresh and store-bought garlic, one can also find it in over-the-counter and in health or alternative medication stores. It's prepared as dried garlic, it's put into capsules, it's made into an extract, garlic oil is sold, powder, tablets, and tea is made from garlic. Garlic indications across the lifespan include with children. There really haven't been any studies to indicate the use of garlic with children, so safety and efficacy have not been established. But garlic may be beneficial to those with hypercholesterolemia, which is high cholesterol. Adults and the elderly, there are no age-related precautions reported, so it's perfectly safe to use with adults and the elderly. During pregnancy and lactation, garlic may stimulate labor. It may cause garlic in infants. So, some nursing considerations. You nurses, you should teach your patient to avoid garlic if they are pregnant and breastfeeding. Teach them to call their health care providers and let them know that they are using garlic as an herbal medication. They should discontinue to use the garlic 1 to 2 weeks prior to any procedure which may cause excessive bleeding, which includes surgery. You should assess their serum lipid levels, determine if the patient is taking anticoagulants or antiplatelets, assess for diabetes and if taking insulin or oral hypoglycemics, assess for hyposensitivity, assess for contact dermatitis. Monitor the CBCs, the coagulation studies, the serum lipid, the creatinines, and the glucose levels. So with that, I would like to give credit to the following people and or websites who have helped me to put this presentation together for you. I would like to thank Foster of the National Center for Complementary and Alternative Medication. He can be found at nccam.nih.gov on the internet. I would like to thank Hodgkins and Cozier, who wrote Saunders' Nursing Drug Handbook, published in St. Louis by Elsevier Saunders. I would like to thank Midham, who published Garlic Central, Garlic Health Benefits at www.garlin-central.com. garlin-central.com. I would like to thank the National Cancer Institute, Garlic and Cancer Prevention. They can be found at www.cancer.gov. And the University of Maryland Medical Center, who can be found at umm.edu. And I'd like to thank all of you for joining me today, and I hope that you will have a wonderful week, and I will see you next week when we talk about horny goatweed. And yes, nurses, that is a real plant. See you next week. Goodbye.